Thank you, Julene. Good afternoon, and thank you all for joining us. As Julene mentioned, we will be discussing building the pillars critical to successfully increasing access to care for ag workers. My name is Lisa Miller. I am the Increase Access Campaign Coordinator at the National Center for Farmworker Health. My work at NCFH really focuses on anything related to increasing access to care. So I work on the Ag Worker Access Campaign that you'll hear a little bit more about in a few minutes, and then also our Increase Access to Care for Ag Workers Program initiative. So that's a little bit about me, and then I'll have my colleagues Gladys and Rocio introduce themselves as well. Then we'll get started.
Buenas tardes a todos. Good afternoon, everybody. My name is Gladys Carrillo. I am the Director of Program Services at the National Center for Farmworker Health. I work very closely with Lisa in our IAC program, and I'm excited to present information to you today. Thank you.
Hi there, everyone. I'm Rocio Valdez. I am the Director of Communications for Ampla Health, and we are in northern, beautiful California. I am as I said, the Director of Communications, and mainly responsible for developing, implementing, and coordinating the communications plan within the organization. I am very happy to be here, and I'm hoping that this presentation brings a lot of valuable information. In fact, I have no doubt that this presentation will bring valuable information for you and your colleagues at your health centers. Thank you for having me.
Thank you, Rocio, and thank you, Gladys. And now let's get started. So these are our learning objectives for today. Today we'll be discussing, again, the key pillars of the Increase Access to Care for Ag Workers Program that we believe are really critical to health centers' Migrant Health Program success. We'll also be discussing the challenges that you guys are seeing and that health centers often face when addressing these key areas. You'll also have an opportunity to participate in a small group discussion to share strategies that have worked for your health center that address the key areas that we'll be discussing, which are staff training, policies and procedures, and outreach. And then you'll hear from Rocio about Ampla Health's promising practice that they've implemented to achieve program success for their health center through Migrant Health Action Planning and Strategic Planning. And then finally, we'll wrap up with making sure that you have information and resources regarding our IAC initiative, and learn about training opportunities and things available on our webpage that you can access easily to assist you in achieving your increased access goals. So as we start, I'd just like to tell you a little bit about our organization. We are the National Center for Farmworker Health. We're a national nonprofit organization based in Buda, Texas. And our mission is to improve the health of farmworker families. So we do that by providing training like we're doing now, and technical assistance to the national network of 174 federally qualified health centers that are funded to provide primary care to agricultural worker families. So, and we also work with any other organization that is involved with the ag worker population. So we're one of 6 national training and technical assistance partner organizations that are funded by the federal government to provide support to health centers that serve the ag worker population. And our work is very closely tied to the goals of the Ag Worker Access Campaign. And hopefully you all have heard of the campaign, but it is a national initiative to increase the number of migratory and seasonal ag workers and their families that are served in community and migrant health centers throughout the U.S. The campaign was actually launched in 2015 as a joint initiative by our organization, the National Center for Farmworker Health, and the National Association of Community Health Centers, which is also known as NAC. And at that time, health centers were seeing a decrease in the number of migratory and seasonal ag workers served in health centers. And so health center staff and advocates knew that we could do better. We wanted to reverse that trend. So the result of those discussions was the Ag Worker Access Campaign. So there are an estimated 4.5 million ag workers currently living in the U.S., and health centers are seeing approximately 20%. So the majority of the ag worker population reports not having health insurance, and they also report not accessing healthcare services. So we know we can definitely do better by being strategic and developing goals to reach more agricultural workers. So that's what the campaign is basically all about. So the overarching goal of the campaign is to reach 2 million ag workers and their families served in community and migrant health centers. As you can see here, since the campaign was launched in 2015, we have been able to reverse that downward trend. And actually, according to the latest data that we have, which is the 2019 UDS data, we've actually surpassed our halfway milestone of 1 million ag workers served, which is fantastic. And that's the first time in the history of the Migrant Health Program that we've reached that number of ag workers, and which is fantastic. And that's due to the great work that you all, health center staff and advocates, are doing every single day. So we still need to keep moving forward. We want to reach that 2 million goal and beyond, and we need your help to do that. So at the end of this session, there will be a link for you to access our webpage and learn more about the campaign, and then also join the campaign to show your support. So our Increased Access to Care for Ag Workers program and associated training opportunities were launched in collaboration with the Ag Worker Access Campaign back in 2015 as well, to assist community and migrant health center staff in accurately identifying and reporting their ag worker patients in UDS. And since then, since 2015, the program has really grown, and it now includes a national virtual network comprised of health centers, primary care associations, and health center controlled networks. And they're all working together toward the mutual goal of increasing access to care for ag workers and their families. So through this program, which consists of training, learning collaborative activities, and support, NCFH has been able to help health centers modify their current systems and registration processes to demonstrate their effectiveness. So as a result, participating health center patient registration teams are now implementing the steps necessary to properly identify and accurately report ag workers when they register, and are also participating in Migrant Health Action Planning to achieve goals. So we're talking about building pillars critical to increasing access to care. Our IAC program really focuses on 3 main areas, which we're going to talk about as pillars today: staff training, policy and procedure, and outreach. So first of all, staff training. What's involved with that? We want to really ensure that all staff are trained to accurately identify, classify, and report their ag worker population in the UDS. So this pillar really focuses on all areas of making sure that's done. That includes training protocols, making sure that staff know that staff are trained on a timely basis when they onboard, and then what type of training they're getting as they go along. So as follow-up training as well. And some of the common challenges that we often hear are really a lack of established training protocols. So how often are you, what's the initial training you're offering to your staff? What's involved in it? What's the content for it? What type of follow-up are you doing? How often are they getting a booster type training to make sure that everybody's still fresh on what needs to be done. And then another challenge that we often hear is staff turnover. So even if you get your staff trained, you have a formal training, then with staff turnover, how are you handling that? Do you have something in place to make sure that everyone that comes in at any time during the year is properly trained? So these are just a couple of challenges. And when we go into our small group work in a few minutes, we're going to hear back from you, because that's the whole thing about our IAC program. A majority of it is the peer-to-peer exchange of strategies on what works for you. So we want to hear about your challenges and then how you are addressing those challenges. And then you hear from your colleagues and get some ideas you can take back with you as well. So our next pillar really focuses on policies and procedures. Do you have a special populations policy and procedure in place? Do you have one specific to your ag worker population? And how is it written? What's involved in it? You know, so that's something that we do a lot for our health centers, is review their current policies and procedures. We have sample policies and procedures that we can provide to you, and then kind of provide feedback and help you to really get those streamlined and make sure that everybody's on board with dealing with your ag worker population. So again, we want to ensure clear and updated policies and procedures are in place for all of our special populations. But specifically today, we're talking about the ag worker population. And some common challenges we see with this are, again, a lack of established special populations policy and procedure, or maybe a generic policy and procedure for all your special populations that doesn't specify the details on ag workers. And it's always helpful to be able to have something a little more detailed so that your staff know exactly how you are classifying your ag worker population, so that everybody's on the same page. And then again, unclear procedures for registration and reporting of special populations, including your registration forms. What we've found a lot of times is that if you, on your registration form, just ask a simple question of, are you a migratory or seasonal agricultural worker? A lot of times that doesn't get you're not able to appropriately capture the population for information purposes, because they may not identify by that terminology. So what we do with our IAC program is really go over your policy and procedure and how and those steps you might take to ensure that you're being really clear. So we have questions that are specific that you can ask that will get to the end result, which is accurate classification, identification, and reporting. And then outreach is, of course, the third pillar, really important, because how are you getting the word out to your agricultural worker families about the work that you do and what you have to offer at your health center? How are you getting the word out to other ag worker serving organizations to let them know that you're there and what you have to offer so you guys can work together? So again, we want to ensure that migratory and seasonal ag workers are aware of the services provided in the health center and have access to those services. So this pillar really focuses on that. And some common challenges that we're seeing, especially now with COVID-19, how are you reaching the ag worker population? You know, with the vaccine, how are you getting information out to folks about availability, about what's involved, and dispel any fears they may have about getting the vaccine. And those are just a couple of examples there. And then establishing relationships. How do you establish relationships with growers to have access to those ag workers to be able to let them know again about your services? And that's a common challenge, is establishing those partnerships. How do you get buy-in from the growers to let them know, again, what you're offering, that your goal is a healthy workforce, which is the same as theirs, and what you can offer them. So these are just, again, a couple of starter challenges. And what we're really going to work on next is our breakout groups, where we'll have discussion on these challenges, and we'll be using a Jamboard. And I don't know if you're familiar with that, but it's actually pretty easy to use. We'll have a link in the chat for you on the Jamboard, and then you'll have a facilitator in your group that will guide you through the exercise. And what we want to do here is identify some possible solutions to these challenges that we've talked about. And then we want you to share what your health center has done to overcome them. So if these are common areas, then how is your health center addressing them? Because again, we want to share those promising practices and strategies, so that if someone is having an issue with a certain area related to these challenges, then they may go back and have a new tool for their toolbox on how to address it. So now we'll break out into our small groups, and we're going to take about 20 minutes, and we'll have one group that will focus on training, one group that will focus on policy and procedure, and then one group that will focus on outreach. And then we'll come back together and report back and share what we've learned from each other. So if we can break out into the breakout groups now.
All right, welcome back, everyone. I was just going to post in the chat that we were about to designate our volunteer for the Jamboard. We were about to see who was going to be reporting out to the rest of the group. So we might need to do that and really get someone to share for us. Do we want to go through each group in particular right now? And I'm happy to share the Jamboard, so we could start in group 1 and then have someone from group 1 report out, and then we'll go through the second group, and then whoever wants to volunteer for group 3 and outreach, I'll let you all give a quick summary of some of the main points that we discussed. Do you want me to share, Lisa, or do you want to go back to the presentation link?
I was having trouble unmuting. Sorry about that.
It's
yes,
okay.
If you don't mind, Gladys, if you can share your screen, that's great.
Okay, perfect. Yes, let me do that. And then we will start with group 1 on training solutions. Is there someone from that group that wants to give a quick overview of some of the main challenges you identified and some of the solutions that maybe group members discussed?
Hi, this is Heather Driver, and I can go over some of those high points with group 1. I'd say kind of a lot of what we were talking about is kind of with protocols and dealing with turnover is training and making sure that staff are trained really well, especially when they come on board, and to go through things even in detail with them, especially like having the electronic manual available for everyone to get to know who they can talk to for help, getting feedback from employees too. Those were kind of the main things.
Great, thank you. I definitely see that really having a process in place for staff could be critical, and having training be a success. I also see maybe some checkpoints here, like the evaluation, that could also maybe keep the staff training moving forward and everyone in line with what needs to happen in ensuring that that quality control is in place. Thank you, Heather, for that quick recap. Do we want to have someone from group 2?
Yes. Actually, we're on group 3, outreach solutions.
Oh, I'm sorry. We did the same board.
Oh, sorry. That's the one that Lisa assigned me.
Okay. Well, then we can focus our conversation there. We had a lot of ideas in that group. So do you want to give a recap real quick for that? And then someone that from our group as well can have that conversation on what strategies we particularly shared.
Sure. I think that in our group, the part of the conversation, it was going back and forth between COVID-19 and also the establishing partnerships. Those were the main two. The workforce issue appeared to be an issue, but not as strongly as this first two. For COVID-19, part of the conversation that we had is the importance of maybe coming up with the COVID pop-up clinics, with conducting drive-through outreach events, and the utilization of social media platforms to outreach more on a digital. We're in the digital era, right? So to outreach, and then given the information that we received today in regards to the percentage of people who do have smartphones, who do rely on their smart phones to get information, it is a great idea to continue our efforts utilizing the social media platforms.
Thank you, Rocio. I think social media is definitely something that we touched on as well. We talked about really capitalizing on Facebook events, using the live stream feature, using a lot of posts for messaging. That was something that came up in our group as well.
One thing that we didn't get to, but I will get to through my presentation, is the utilization of radio, local radio stations. I don't think anybody mentioned that, but I've found that to be very valuable, especially when it comes to having that that air during the best time when people are actually listening, whether they're working or not. And the agricultural community may be working, but at the same time they're listening to the radio. You know, and they may be able to, and that's one of their primary sources to get information, and to get information not just as to what is happening while they're working, as far as the news, but also as part of their entertainment.
I agree. It's definitely, I don't think we mentioned it in our group either. So it's something for us to keep in mind, you know, radio, media, things that we can use outside to really communicate with the community and connect with them. I know WhatsApp is a very common application utilized by the agricultural worker community as well. So that's something that we see often.
Now, one of the challenges with that, and I'll ask this question in case others may have the same, with the WhatsApp and the social media platforms, there is only so much that you can really say due to HIPAA. Right? HIPAA regulations. So how much information can you and should you be able to provide through this kind of platform where people may be sharing their entire medical history with you? So, and that's been part of the challenge that we found out. So there's only, as part of our solution, it's been to provide a generic responses, to always send the person, in this case, the agricultural workers, to a telephone line where they can contact someone and get their answers, get their questions answered.
We also have some really great ideas in terms of ways to drive patient engagement and increase partnerships, through a variety of events and even incentives, so that patients feel connected to the promotores, And not only that, they feel like they can really feel comfortable in establishing those relationships, to ask questions, and just have more information about healthcare in general. We noted that it was really important, even, with growers and farmers, to have an identified shared goal. What is it that we have in common that we can accomplish together? How can we collaborate and work together to reach this vulnerable population? That was definitely one of the things from the group that came up from the discussion as well.
Can I say something? Yes, I was also, I think that sometimes we don't view farmers and crew leaders as partners. We don't view them as partners sometimes. And even in that conversation that we had in our group, at first I was thinking, no, they're really not our partners, but they are our partners. And having a great relationship with them is important, but sometimes it's difficult because they don't always see us as their partners, and we don't always see them as our partners either. But having a good relationship with them, at least a good working relationship with them. And I love what you said about a common goal. One of the things I know, I just want to say this real quickly, that when we were doing COVID testing last year, it was met with a lot of resistance. But since we've been offering COVID vaccines, I don't even have to call the farmers or crew leaders, they're calling me. So, and we're using that as a great opportunity to build the relationship that we have with them. So I thought that was great what you said.
Absolutely. That is very, very important. Establishing those good relationships are always going to be, they're going to pay out. They're really, really going to pay up every time. During COVID-19, I was also contacted by at least a couple of growers and also business owners who wanted and needed to get their staff tested for COVID-19. So why do they feel that so comfortable in calling directly? Because that relationship was established, from a long time ago, and it's been a relationship in progress. And prior to that, maybe this person, at least one of those two people, had never called me before. And I got the call on my cell phone number, by the way. Had never called me before after that. I mean, before that. But I guarantee that now, when we have our staff go to their business, they'll be more welcoming and they'll be more willing to provide all these outreach materials on our behalf, because they've already experienced the value as to what we have to offer. And I think that's part of the challenge too. Help people value and understand what we have to offer for the communities that we serve, because it's of great value.
And I think that's a great segue into your presentation, Rocio. I want to really highlight that. Ampla is our 2020 Promising Practice Award recipient. So I think it's, yes, I think it's great and very telling, the fact that, the growers are calling you personally, Rocio. So why don't we go ahead and transition to you, and let's go ahead and really feature you as our speaker in sharing some of those strategies that have worked so well for your organization that maybe some of our attendees can truly pick up for their own sites and implement some of these strategies to have just as much success as you.
Well, thank you. Thank you so much. Let's do this. And thank you for the introduction, Gladys. Thank you so much for the invite as well. Lisa, Silvia Partida, Alicia, everybody at NCFH. We really appreciate this, appreciate the opportunity. And I have to say this, this is something that I've been waiting for. I waited for 5 years, I would say, 5 to 6 years now. I'll tell you a little bit about myself. I started working for Ampla Health exactly on in 2014. That was March 31st, 2014. So my 7th year anniversary is coming up. So this is a great gift for an anniversary, because it really shows that everything that we have worked for as an organization, as a committee, as an individual, professionally and personally, that we are so passionate about doing things because we love to do what we do. We are here to serve others, and this is a great opportunity that Ampla Health has given me. And I'm sure that for all of you who are currently working at your organizations, I'm sure you're there because you're passionate and compassionate about the situations that our patients go through, the need that there is to receive the services and the programs, to participate in the programs that we offer. So thank you so much for being part of this. And in 2014, this is something that, to be honest with you, I really had no idea. But I came in right just at the beginning of the Increasing Access to Care campaign, which started in 2015, like Lisa Miller had mentioned from the very beginning. So I have to say that the very, very first conference that I attended, and those of you who are joining may have been in that conference as well. That day, by the end of the conference, it was my very, very first conference with NCFH. And that day, before we left, we were provided with a little paper. It was a note, and it was more of a commitment. I don't know if you guys saved those, Lisa and Gladys, but every single one of us who attended that conference were provided with this little piece of paper where we made a commitment, a professional and personal commitment to work towards the goal of increasing access to care for our agricultural worker population. So that's what I did in 2015, and that's the reason why on a personal and professional level, this is really, really important, because not only have I seen the need, but I've lived through that need. I came here 32 years ago, and when I first came here, I am the daughter of agricultural workers, and my first job was in agriculture as well. So I picked peaches and did a lot of different agricultural worker. I'm not going to go down the list, but I can tell you that I saw and felt firsthand the kind of difficulties that people go through, especially when they are undocumented, as I was. And during that time, it was really a learning experience. And at the same time, it was something that gave me the opportunity to learn and say, you know, what can I do differently? And when I do something different in life, what can I do to help these people? Well, here we are. So as part of that mission in life, and as part of our mission in for Ampla Health, we decided to commit to this campaign, increasing access to care. And the first thought that we decided to do was to actually, at least I committed to find a way to convince and to bring back this information to my executive team leaders and the rest of my senior management colleagues, so that we could find ways to really implement this type of campaign within our organization. I have to say, it was not easy. It was not fast. It took some time, but it finally happened. And when it happened, not only did we have the support from our executive team members and senior management, but most importantly, we had and we got to have the support from our board of directors, I'm sorry. So that is some of the key elements that I feel that I'm going to be sharing with you today. But before I go into the presentation, I also want to give tremendous credit to this group that you see here. From left to right, you see Cindy Peshek. She is our outreach program manager. She is currently in charge of the outreach program with the enrollment and outreach specialist, as well as the promotoras. Next to her is Jessica Fermin. And then we also have, she was a promotora who actually had to move out of the area and left us. But since then, we actually added 3 more promotoras. So I guess she was like a lucky charm. Lourdes Guzman, she is one of our wonderful site administrators who's been with the organization for, my goodness, over 35 years now? Close to 40 now, I think. And funny thing is that when I first came from Mexico, she was one of the first people that I met. And I happened to meet her at one of the Ampla Health centers that before it had a different name. In the center, we have our CEO, Benjamin H. Flores, that without his blessing, without his support, without his passion and compassion towards the agricultural community, I don't think we wouldn't have been able to begin this type of adventure, into including a direction into a strategic plan to specifically increase access to quality care for the agricultural worker population within our 2019 to 2021 strategic plan. Then it's me right there next to Ben, and right after myself on the right-hand side, you'll find our wonderful WIC director. And also, she is a co-leader on this strategic planning under the direction that I'm also responsible for. Her name is Rose McIsaac. And again, she has brought in so much value to our group and our committee. And I also have to give her some credit, great credit, because she was very, very instrumental in helping and putting this presentation together. So now that I presented you the committee members, on the back, you see that is a blown up graphic of our strategic plan. And that's where every single direction, you can't really see it very clearly, but we have progress bars to see where we're at. And I can tell you that we are pretty much at 100% completed in all of our objectives. And I'll go through that a little further. So if you can go to the next slide, Lisa. So in order for us to be able to do what we are doing now, we have to start with the step number 1, and that was to evaluate. So next slide, please. And to evaluate, we use a community needs assessment. So we had to evaluate the results between the review of the 2017 community assessment that was provided. And this is a assessment that we really didn't find any significant information. And we also had to review the resources on the NCFH website, the National Centers for Farmworkers Health, and the webinars were also incredibly helpful. I have to say that a great deal of our success, I give credit to the National Centers for Farmworkers Health, because they are the leaders, and they're a great resource, and they're there to help you anytime you need information, anytime you have doubts, anytime that you don't know which way to go. That is your number 1 resource, where you can. They hear it from all of us. So they are the people that in the organization that really, truly have your back. So make sure that you reach out to them anytime you're looking for strategies, anytime you're looking for to hear, what are other people doing? What are other people facing? Are we the only ones? I guarantee they will help you understand that you're not alone. We're all in this together. Really, literally, just like we are right now in the middle of this pandemic. So this step number 1, we evaluated, and that was something that was we were able to complete within a 90 day, within our 90-day victory, and we completed that at 100%. So then we evaluated the front desk practices to improve our data collection. That's where we found some needs to change. And the evaluation's results was that we needed to update our registration form. If your registration form is not up to date and is not offering the questions that will capture the data that you need, it's going to be very difficult. So the second thing that we figure out that it was important to incorporate during that registration process was the need for a pictograph tool. So that's what we did. We utilized a pictograph tool, and we started with that in the summer of 2019. That's when we completed this specific objective. If we go to the next slide, you'll see that after we evaluated our current policies and procedures to improve the access and improve the agricultural worker identification, we found out that actually our policies and procedures were in line, and we didn't have to do much to that. So that was another thing that we were able to complete at 100%. Next slide, please. The step 2, we got to take action. We have to do something, right? So what do we have to do? Here we go. As I said before, we developed a visual tool for improved agricultural worker identification. If we try to explain to people what is an agricultural worker, in short, it's going to be very difficult. But if we find that, or if we create the kind of tool that people can go through, and it's something very easy to use, very easy to see, people can actually go through that and identify themselves. Even though they may not consider themselves to be agricultural workers, they may realize, wait a minute, well, I am an agricultural worker, after all, because I am work in this type of production or crop production industry. So this tool that was created in the summer of 2019, we piloted it in the fall of 2019, and we fully implemented it in February. And that is what we have continuously utilized to help our patients identify themselves when they're in doubt. I'm not sure if I'm an agricultural worker. I haven't been working, but if you did, okay, what kind of job? Well, what kind of work were you doing? If you haven't been working within the time frame that would still qualify you as an agricultural worker, we want to know. Okay, next slide. This was part, as I mentioned, that was incredibly important, was to update the registration form. This was an improvement, and it took a little while to get this implemented, but we didn't get it implemented until it was fully completed, until we were absolutely sure that it was going to work for all data collection, that it was going to work for our systems, and that it's going to be compliant with everything that we are required to do. Next slide, please. So then we develop and execute a training plan. Lisa was saying something really important. One of the main issues is training. Number one, finding time to train the staff, it's very important, whether there's COVID-19 or without COVID-19. The initial training on pictograph and registration form was something that needed to be done, because if our staff is not aware of the changes that have been done to the registration form and they don't know the purpose of that, they may not be able to capture that data in the same way as if they understand it. So first, we have to get their buy-in as well. And part of that is providing with the training. How can they help our patients utilize that initial training, that initial pictograph? If they don't know what it is, if they don't know how to use it, it's going to be much more difficult for our patients to utilize it as well and to be able to identify themselves. The semi-annual review training was something that was added to the training plan. And it's something that there has to be a commitment. And let me tell you a little bit about where that commitment came from. Prior to NCFH support, and what I mean by support, NCFH actually provided a in-person training. They came to our corporate office and provided a specific training to our management teams. And this was one of the biggest challenge I feel that I encountered, getting the support and getting the buy-in from other staff members. It was very difficult to get site administrators, nursing supervisors, clinic leads, and some of our front staff to take pretty much a full day to get that training that was being offered, and thankfully to the support and buy-in from the very beginning from our CEO, that was something that was we were able to accomplish. But our COO was questioning, and I tell you with the exact words, Rocio, why do you want to take my staff out of the clinics? How can I leave my staff without a site administrator, without a nursing supervisor, without the clinic leads, and even with front staff? What are you talking about? So I explained, in order for this to make sense, in order for this to bring the results that we need, these are the people that have to be engaged. These are the people that have to understand what this increasing access to care for our special population, agricultural workers, is all about. If they don't understand it, if they don't see how that can be applied, it's not going to be as easy for us, and we're probably going to continue for many more years before we're able to implement it. At least that was my way of thinking at the moment. Not that would have happened exactly that way, but I feel that this way it happened sooner rather than later. So thankfully, the support of our COO was incredibly important as well. And he says, okay, Rocio, well, you can have all my stuff. They'll be there. So getting the buy-in, that's why I say, talk to your executive team members. And if you are in a position where you don't necessarily have the same access to your executive team, we are very, very fortunate to have an open policy, specifically and mainly with our CEO, who has given us that opportunity and that freedom to have an open door policy that if we have something really important like this, he'll listen to us. Of course, he's the one making those decisions, and he took this to the board of directors, who were so wonderful in helping in adopting this as well. Without that, none of this would have happened. So then, if we go to the next slide, we can't do training and we can't implement something without monitoring and auditing for compliance purposes, and also to find out how well we're doing, or what are we lacking, or what are the areas that we may need to modify, etc. So starting in January 2020, we started conducting a weekly compliance audits across the health centers for completed registration data collection accuracy. With the help of the site administrators, they are responsible and they are conducting these audits to figure out where are they at as far as collecting this data, where they can actually do one-on-one trainings at the moment. If they find out that maybe one or a couple of their staff are having difficulties in collecting this data, then there is the other type of training that will take effect at the moment, so that they can actually get the help that they need, and we can ensure that that we have a good practice established. Can we go to the next slide? And this is where I was talking about providing the one-on-one coaching as needed. Our site administrators are, so, I don't have enough words to describe them, as I'm sure you probably feel the same way. Our site administrators, they are super women. They really are. They do so much throughout the day. They are in charge of so many different things, and they still have and make the time to conduct one-on-one coaching as needed. So these site administrators are fully committed, and they're using the data to identify the staff that are maybe lacking the data that needs to be collected, and that's how they can actually help them overcome any challenges that they may have. This began in the month of May of 2020, and it's an ongoing, just like all of our trainings. Next slide, please. So how do we talk to our patients? How do we get the word out? what's, that is part of the challenge, part of the challenges that we were just talking about as part of the outreach solutions. So what we started doing, we developed agricultural specific marketing materials with some posters and flyers in multiple languages. And part of the challenge was to include all of these materials in every single examination room, because let's face it, we don't have a lot of room in the examination rooms. There's really not enough space in our lobbies, or our wait stations can only take so much, right? Otherwise, the centers will become full of paper on the walls all over the place if we were to include so much information. So with the help of, and the great idea of my colleagues and committee members, we came up with the idea, well, why not, instead of printing this and placing it at every single examination room, why don't we provide this at the time when they have to sign in on the sign-in board? So just one poster could do more, or one flyer could do a lot more than what 100 or 500 posters could do, by asking this simple question: are you an agricultural worker? ¿Eres trabajador del campo? O eres trabajador agrícola? And I'm not going to try the other two languages, which is Punjabi and Hmong, because I'm only bilingual as of now. So we develop also telehealth, census registration, medical expansion, and public charge information, targeting specifically the agricultural worker population in the summer of 2020. So again, these were programs that were of interest of this population. So you have to think of the kind of thing that, or the type of things that are going to be of interest to the population. So telehealth, given the circumstances with COVID-19, was key. And the census registration was another thing. And that was through a partnership that we also had, and a grant, as well as the medical expansion, public charge information targeting the agricultural worker population. So looking for those things that will gain their interest, that will also help you gain their trust, is going to be ideal. Next slide, please. As you can see, that was also completed.
And Rocio, we're running a little short on time because we have to allocate time for Q&A.
Absolutely.
So, we have about 3 minutes left. I'm sorry.
Oh, no problem.
Okay.
So I'll speed up my presentation. I thought I was going to have too much time. So then we developed a media campaign. So not only social media, but also we are using the traditional, the Spanish radio stations, Spanish live interviews, and Spanish radio spots. Since then, we have done 18 live interviews, and that's from February 2020 to February 21. And that's once a week, and sometimes 2 per week. The Spanish radio spots, we've run 895 spots, and they're ongoing. This is up to February. By now, we have probably over 1,000. Facebook, Instagram, and Twitter, those are our main social media platforms. And I would like to take the opportunity to please ask you to follow us. If you have questions, follow our Ampla Health social media platforms so you can see what are the things that we're doing, and maybe that will be something as part of the ideas that you can utilize. Next slide. With the, we also had to increase education and community forums targeting the agricultural workers, but we had to cancel a lot of the projects due to COVID-19. This was an objective that we were not able to comply with or complete. Next slide. I'd like to introduce you to our new hire promotoras, some of which have been here for, I would say, almost a year. Some have been here for half a year, the other one just a few months. So we started with one promotora, and this organization only had one promotora for many, many years. They never had more than one. And this was part of one of my desires and dreams, and something that I thought we really need a promotora per county. We serve 6 counties. We're only halfway there. So this is Maria, Adriana, and Catherine. And next. So we developed and implemented outreach strategies to increase utilization. Some of these actions had to do, as I mentioned before, the utilization of the Path to Health program to market to undocumented workers with cold calls. That's all we could do. We also distributed helpful information and services to agricultural workers to develop Ampla Health as a reliable source for community sources. Our promotoras are really doing a good job in looking to do things outside of the box, because they really can't go and see our patients or the agricultural workers where they normally would before. Next slide. Next slide, please.
And actually, Rocio, we're going to, Julian has to make a quick announcement about evaluations because we're at the 5-minute mark and we haven't had time for Q&A yet.
Absolutely. Go ahead.
So we'd like to have a special thanks to our sponsor for this session, which is Angel Flight West. I'd also like to draw everyone's attention to the chat box. I've just put in the link for the evaluation. If you could take a few moments to complete that, we appreciate your feedback. I'll send it back to the speakers. You have moments to finish up, and I believe this is the time for Q&A. So if there are any questions.
Thank you, Jolene. And thank you, Rocio. I'm glad that we at least got to the last slide of your steps, which is assessing the success of your, the steps you implemented in your program. And that's definitely critical to evaluating how effective your strategy is. So we encourage you, if you implement changes, to really look at what was the impact and how that affected service delivery at your sites. So if you have any questions that Rocio or our staff at NCFH can answer, we'd be happy to do that now. I've also entered several resources in the chat box. Feel free to check those out. They're related to information about resources that Rocio mentioned and that we have available at NCFH. Thank you for the plug, Rocio. We're always happy to help anyone that needs our assistance for any training or technical assistance as a national training and technical assistance partner. So we'll go ahead and open it up now and see if anyone has any questions that we can address.
Yes, please. And don't forget to follow NCFH on their social media platforms.
So there is a question in chat. It says, has your team worked on patient portal use and or education for migrant workers to understand and easily access?
It's a good thing you bring that to our attention. We are just in the process of starting a new implementation, a new EHR system that is going to bring in a new patient portal that is definitely going to allow the opportunity to train and to help our patients, to guide them to know how to utilize it. So we have had some opportunity to do that, and we did that by utilizing especially the help of our enrollment staff. They would come in and they would assist the agricultural workers to sign up on the patient portal. And a lot of times, they didn't even have an email. So with the help of our enrollment workers, they actually were able to open an email and also open up an account on their patient portal, get their passwords, and they were provided with their passwords and all the information as to how to sign in into their patient portal. That was something that was done before, but now that we are going to have a new patient portal, it's definitely going to give us the opportunity to do something similar to that.
Thank you, Rocio. And so as we wrap up, we're going to leave everyone here with information about our Ag Worker Access campaign, which is truly the initiative that inspired us and Rocio to really advocate for agricultural workers across the country. If you haven't joined the campaign, we welcome you to be a part of this initiative. I think that's definitely the first step in truly advocating for this population and trying to make changes so they have access to quality health care. So please join our efforts. And we also invite you to contact us individually if you have any other information. We're happy to answer any questions that you may have about our programs, about Rocio's promising practices, and even invite you to join our collaboratives. That's how Rocio was able to work with us and became eligible for the Promising Practice Award as an IAC Learning Collaborative member. So we encourage you to join our efforts to utilize our support and services and to reach out to us if you do have any other questions or need of any resources that we can provide. Thank you, everyone.